Hi, I'm Dr. Mark Scott. I've been in practice here in Virginia Beach since 1996. I'm the founder of the Total Health Center, and today I'm going to share with you how we successfully treat chronic headaches at the Total Health Center. If you're watching this DVD, we can just about guarantee one thing. You or someone you care about is frustrated with their health. The first thing you should know is we do things a bit differently. The biggest difference is in our treatment philosophy. Treat the person, not their diagnosis. Why would I say that? Well, a diagnosis is just a label, a set of words. It's what the healthcare system uses to classify us and put us into neat little boxes that fit the criteria set forth in textbooks. Here at the Total Health Center, we know that you're not that textbook definition, not some label. Instead, we know that you're a human being, for God's sakes. Now, don't get me wrong, a diagnosis can be useful. If you came to me and said, I have restless leg syndrome, or my child has ADHD, we may have a place to start. But every day, people are misdiagnosed, given false labels, false hope, and needless worry. Where the problem lies is that the diagnosis won't give me the most important answer of all. What is the cause of your problems? Yes, your child may have ADHD, but why does he have it? Without this all-important factor, how could we ever begin to think that we may be able to offer some type of relief, not to mention a cure for these debilitating and chronic conditions? We know there are no cookie-cutter protocols for these conditions. We are dealing with flesh and blood human beings, not cold, unfeeling textbooks. We begin by asking, what is the mechanism? Why is this happening? To answer these questions, we use a new treatment program drawing on multiple sciences and health fields, including functional neurology, functional metabolic testing, chiropractic neurology, and brain-based therapies. Let's start with functional neurology. Functional neurology is a method of treatment that aims to integrate all of the brain's sensory activities in order to treat a variety of clinical and subclinical symptoms. This modality draws from a number of complementary and alternative health therapies. Correcting neurological problems and restoring functionality in the body may be possible by participating in a variety of exercises whose aim is neurological integration. These exercises involve specific forms of or exposure to movement, scent, sound, light, and touch. Drugs and surgery are not a part of this modality. When you come into the office, we may have you do simple things in a specific way, such as tapping to flashes of light or listening to music in one ear, tracing a maze. The simplicity can be deceiving. The secret is in stimulating the weak areas or inhibiting the over-dominant areas of the brain and nervous system. We see a lot of headaches at my clinic, and when someone comes into me with headaches, the first thing I do is to determine what type or combination of types they are having. The important point I just made is combination of types. You see, most people think a headache is a headache. Heck, many doctors treat headaches with the same medication regardless of type. I classify headaches into 3 categories. Number 1, structural. Number 2, metabolic. And number 3, neurological. Structural headaches include subcategories like tumors, vascular issues, sinus, and most commonly, musculoskeletal imbalances. Incidentally, a recent study found that 80% of headaches are cervicogenic in nature, meaning they stem from misalignments in the neck. By the way, tension type, sinus, as well as migraine headache diagnoses fall under this category. Metabolic headaches include subcategories such as chemical sensitivities, food additives like MSG and aspartame, sensitivities to cleaning chemicals, airborne pollens, molds, and other chemicals, hormone imbalances, food sensitivities to gluten, soy, eggs, blood sugar problems, and other imbalances with the body's metabolic processes. A migraine, hormonal, sinus, and cluster headache diagnosis falls under this category. Neurologic headaches refer to imbalances in the sensory integration of the brain's activities, resulting in many chronic undiagnosed conditions, such as headaches. Migraine, cluster, and tension type headaches fall under this category. We use specific brain-based therapy, such as vibration therapy. Vibration stimulates the back part of the brain called the cerebellum. One of the functions of the cerebellum is control of the spinal muscles. We may also use auditory, visual, olfactory, and caloric stimulation to increase stimulation to specific parts of the brain. Interactive metronome is a computer-based program that uses visual, auditory, and motor stimulation to increase firing of the brain. Doing some detective work, neurologically, this is what makes us different. Another thing that makes us different, functional metabolic testing. You may have already had lab tests done, and the results came back negative. This is where functional metabolic testing comes in. In medicine, they use pathological ranges. These ranges are very wide, and if you have a positive test with these ranges, you are in the pathological state. You see, most diseases develop over time. It's a gradual process that eventually ends up as a diagnosable disease. Think of the dentist. Before you have a root canal, you have a cavity. Before the cavity, you have plaque. It's a process that results in a root canal. The pathological ranges are looking for root canals, not plaque. Functional ranges are looking for the plaque stage. For instance, blood glucose. The range can be from 70 to 115. Optimal is 85 to 99. Blood glucose can have an effect on your brain and nervous system. If you are getting to the edge of the pathological range, you're sick, just not diagnosable yet. You are comparing yourself with sick people. Functional ranges are comparing you to healthy people. We look at functional ranges. Unless you are seeing a doctor trained in this style of practice, you are not going to find the cause of your problem until you need a root canal. We will not leave any stone unturned. By using specific blood tests, such as thyroid panel, a complete metabolic panel, a lipid panel, a CBC, or a complete blood chemistry with autodifferential, we can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, and gut function with the above tests. All can be affected with chronic conditions. By addressing these problems, we can help you heal faster. Remember, the body is constantly performing a balancing act. An imbalance, metabolic or neurologic, could be the cause of your chronic headaches. You see, the health of your nerves is dependent on metabolic processes. When you have a metabolic imbalance, you can have weakened nerves that are more susceptible to headaches. Another test we do is sensitivity testing to determine if you have a sensitivity to gluten, which is wheat, rye, oats, and barley, milk, eggs, yeast, and soy. If you are sensitive to any of these food groups, it could be making your condition worse by increasing inflammation in your brain and throughout your body. Adrenal stress index. You can test the adrenal glands with a test called the adrenal stress index. This is a salivary test, much like the DNA testing. The adrenal glands sit right above the kidneys, and they are your stress organs, meaning they react to stress. If the patient suffers from stress, insomnia, and/or diabetes, this test is a must. It will measure their cortisol levels. Your headache could be hampered by an autoimmune condition. Your immune system could be attacking your brain and nervous system. This is why the immune panels are so important. 99% of our patients have already been to 5, 6, even 7 doctors with little or no long-lasting results. For the most part, all of the specialists look at only that part of the system in which they are trained. A cardiologist looks only at the heart and its vessels. An orthopedic wrist specialist, only the wrist. A dermatologist, the skin. You get the picture. This approach has failed for a great many of us. You have to take a step back and view the big picture, the person as a whole, not just the parts that make up that wonderful and complex being. With all the advances in technology, the big picture has been missed. To get the great results we do, we must be really good detectives, trying to find the problem's root cause. That means doing the necessary test, whether or not any out-of-touch and self-interested insurance company thinks they're medically necessary or not. Are you suffering with some chronic condition, or maybe no one even knows what's wrong with you? Or worse yet, accusing you of making it all up? Or that it's just psychosomatic? Have you tried various medicines and seen numerous and varied healthcare providers? Have you gone through treatment after treatment just to be let down again and again, made to feel like a burden and told to get on with your life, learn to live with it? Thousands of patients just like yourself have suffered, felt hopeless and alone, and felt that no solution would ever be found, despite the many sincere prayers made for help. So ask yourself the following questions. Honestly, consider writing down your answers. Number 1, how much has this condition affected your job, relationships, finances, family, and other activities? 2, what does it cost you in time, money, happiness, and freedom? 3, where do you picture yourself in 1 to 3 years if this problem isn't taken care of? 4, what is it worth for you to be able to live your life without this problem being such a burden? You may have been told by other doctors that there's nothing wrong with you, or it's all in your head. What that doctor should have said is that there's nothing that I know of to help you. If that doctor says that there's nothing wrong with you, then he or she assumes that they know everything. You may at one time given in and just figured that you would just have to learn to live with it. Even if you believe or have been told that you couldn't recover, or you have a permanent, unchanging condition that could only get worse but never better, what if it were possible to be 30%, 50%, or even 80% better? What would that be worth? What about being 100%? What would you do to be able to achieve this? Now don't get us wrong, we can't help everyone. That's why we thoroughly evaluate every patient that comes into our office. We have to determine whether you're a candidate for care or not. Let's do some detective work and find out what's out of sync. As I mentioned earlier, we do things a little bit different. First, we're going to look at all the systems in your body and find out where the lack of communication is. The beautiful thing about this is that many times people find improvements in other areas of their health. Remember, we are not treating just your symptoms or diagnosis. We are helping your body function better. When you function better, other areas will improve. I don't care what you've been told or who told it to you. You do not need to suffer. We have helped many people who were told they would just have to live with it. And when we cannot help, sadly, we can't help everyone, I tell them that there's nothing that I know of to help you. But keep looking. There is an answer out there. That's why you're here now watching this video. That's how I came up with this whole system of treatment. I kept learning, and I will continue to keep learning. If you want us to help you, give us a call. But whatever you do, don't give up. Keep looking and keep learning. If you decide that this is something you want to explore further, you need to follow some very important guidelines. Number 1, completely fill out all paperwork that came with your packet. I'm going to read every line. Again, this is what makes us different. Number 2, mail the paperwork to the office. We cannot set an appointment until we receive all of your paperwork. Number 3, once we receive the paperwork, our office will give you a call to set up an appointment.